of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everyone.
Good morning.
We need a motion this morning to approve our agenda.
Second.
Bruce and Mort, all in favor?
Aye.
And we have minutes from January 18th to review.
I move approval of minutes of January 18th.
Carl, is there a second?
I'll second.
All in favor?
Aye.
No general public concerns this morning. Let's move down and do claims first. There's not a large amount of claims today, and we can get started on those. So everybody kind of got a chance.
I reviewed the claims, and general, we had $136,200.56, and for drainage, had $45,992.00. I move their approval.
We have a motion, is there a second?
I'll second.
Bruce, all those in favor?
Aye.
Opposed? All right. How about the sheriff's quarterly report? We can take a look at that too, I guess, yeah.
Is this in line where it's usually at, or this is the first one I've seen?
Yeah, I would say he's always in that 12 to 15,000, 16,000 range a lot of times. Depends on those concealed weapon permits. Some of them must be coming back around due. Is that what's going on more?
Yeah,
Is that what we're getting new?
5 years,
That way there's some
not yet, we'll renew them again.
With those mileage fees collected, that'd be transport to mental health.
Some of them would be, some of them are when they're serving papers on people. I don't know if they include the mileage in with the services, or if they spread them out.
I make a motion to approve them as printed.
Thanks, Bruce. Do we have a second?
I'll second.
Rick, any more discussion? All in favor?
Aye.
All right, I think it's close enough. Mary, if you'd like to come up, and I'll slip this in.
Hi, Jamie, how are you?
Fine, sir.
I'm good.
You're welcome.
Mary was getting nervous that you were...
Nah,
I wasn't getting nervous. I was getting nervous. Good morning, everyone. I'm Mary Wortman, the Outreach Director for Humboldt County, that's where I'm at. This is Jamie Whitney, he's the Executive Director. And first of all, I'd like to thank all of you for your time today, and especially want to thank Bruce for sitting on our board. We're here today in regards to the funding letter that was sent to you last month. We're asking for the County of Humboldt to continue to partner with us through your financial support so that our agency can continue to meet the needs of Humboldt County's most at-risk constituents, such as the low-income elderly or people with disabilities. The majority of the people that we serve do not come to in-for services, or it's hard for them. People want to be independent, they want to be self-sufficient, but occasionally something happens in a person's life where they need a hand up. And that is what Upper Des Moines Opportunity Services is all about. So each of you have the funding letter. I passed that out to you, and there's a few things that I'd like to highlight, some numbers that I feel that are important numbers to you. On the first page, it shows in fiscal year 15, Upper Des Moines Opportunity assisted 1,039 individuals and 386 Humboldt County homes. The second page of the letter shows the demographics of who these people are. And the last page of the letter shows the total cost for the services we provided these individuals in fiscal year 15, and as you can see, that number is over $243,000. Upper Des Moines Opportunity is Humboldt County's community action agency, and the agency that gives a hand up to help individuals and families continue on the road to self-sufficiency, but we can't do it alone. So I asked the Humboldt County Board of Supervisors to continue to financially fund us. And with that, I'll turn it over to Jamie.
Mary does a good job pretty much laying all that out. I did a couple of things I wanted to make sure we emphasized, and we do this every year when we meet with you, is that all the money that we receive from local foundations as well as from the county stays in this county. That seems to be a misunderstanding from others in the community. That is not what happens, and that happens with every county. So I want to reemphasize that because we've gotten feedback that that's people believe the otherwise, and that's not the case, and we can show that. One of the big issues that has been rising across the board for all our counties recently, and I am not quite sure why that is the need for support for families with low income for housing services, and that seems to be a growing need. Unfortunately, it's not a growing funding, but it's one of those huge needs that we're having to budget for more and more. We currently provide that service with 2 grants, which includes this county as well, for what they call tenant-based rental assistance, as well as Emergency Solutions Grant, or it used to be known as Emergency Services Grant is what it was called. The ESG grant primarily serves those who are at risk of losing their home if they're back rent, or if there is the intent of shutting off the utilities or whatever. Will help to keep the family in the home with that. PRA is a buy-in program, meaning that they have to contribute. It's not something that we just give a subsidy to. When we help them, assist them with the rent, we've approved them for that, they have to contribute so much towards that rent, so it's not a walk-away, easy-to-get money thing. And if they don't follow the program and request for going to work or whatever the issue, then we release them from the program. So they can get that service up to 2 years, depending on if they need that service, until they get on public assistance to help take care of that, like Section 8. You guys are a unique county. We don't provide a lot of the individual, like food programs. That's done by your ministerial alliance, and we work closely with them. I know Mary does. But we do and continue to provide a lot of emergency crisis services throughout the area, and that's something that continues to rise for a lot of families. It's getting, I don't have to tell you, nationally, we're still at 15% poverty in this country, and that's still a high rate, especially in the rural areas, because there's not a lot of industries building, so we continue to use those services for that primary reason. So, again, I just want to reemphasize the importance of what your money is used for, and with that,
I got a question. I see Dean Humboldt's on next from Veterans Affairs, but, you know, I think both your organizations help the lower-rent housing, people in need. Do you guys communicate back and forth? Is there ever a case where one guy's getting money from both sources?
Well, go ahead.
I can tell you that, Carl, one really nice thing is that the Ministerial Association and Community Services, we have a quarterly meeting, and we also, at that meeting, I believe you're invited as well to that. So, we do try to keep in communication with one another. We work really closely with the Ministerial Association and with Community Services. So, you know, there is communication there.
I think it's good. I'm just curious, something once in a while to get some...
You know, I would say that you know, I'm not gonna say that that doesn't happen, because I'm sure at times, but you're, the majority of the time, no, Carl.
Great.
Because I think that, you know, I sit on the ministerial, meeting, I go to that meeting with, and Bruce goes to that as well. You know, we keep close contact with one another.
In a smaller county, it'd be easier to do that, you know, than a lot.
You know, it is.
It's probably
It's a lot easier here than it is in Webster, for example.
Yeah, sure. It would be.
And we've had situations where families have tried to do that and told us, no, we're not getting anything, and then we find out that they have, because we do check. We have to enter our information, what they call HMIS, which is the housing database that's used by HUD. So if it comes up down the road that you've been doing that, yeah, that's a red flag for us. And we also do that with our THO system, it's called. Once they're in it, it'll tell us if the client is on services somewhere. And we've had, I think last year was a big rush of clients going from county to county and trying to get to the same service.
Right.
And it flagged us, and we'd stop it right away, and we'd warn the next county.
I sat on that ministerial for a while, and somebody'd come to one church and get money,
Yes.
the next church get money, so they started running through the sheriff.
We talked about that, right. So I think that, you know, when that happens, Carl, I think that this county does a really good job in and being proactive and trying to figure out other ways to, feed that through. So, yeah, I think that's good.
You could work, I just always wondered that, so,
Yeah.
all that question.
Yeah. And we try to partner with every community entity out there that provides like services like this, so we can keep that duplication down, so.
Well, and like Jamie said, he talked about our, data system that we have. If somebody came from another county and had applied for energy assistance, let's use that as an example, and came here, it comes up and says, you know, they've already applied in Cassuth County, for example, because that's close to us. So, you know, that's another good check for those situations.
Well, the other policy, and as you mentioned that, brings it open, that we've emphasized last year, as a matter of fact, we put a new procedure in place, is that people are only allowed to apply for $500 a month for any kind of emergency or crisis services that we do, and we track that. So it's not something they can keep coming in year after year and doing. We always monitor that every year, so we monitor that.
Do you ever, it'd be nice to see if some numbers going up or down areas. I mean, compared from one year to...
From one year, right, and I was just gonna...
Are we getting more people on assistance, are we getting less people on assistance?
I was
In the age group?
prepared for that question.
Good. You're always prepared.
Well, no, thank you. From fiscal year 14, we are up for fiscal year 15.
Okay.
Yeah, I checked on those numbers, not a whole lot. An example, the individuals was 1,039 individuals. The previous year was 964, so...
A little bit.
A little bit. But I think we've seen an increase of people coming into Humboldt County too. I mean, look at the job opportunities you have going on here.
Yeah.
I mean, it's awesome.
I know housing is tough in Humboldt to find a place to live.
Right.
Not
That is
any worse
something
than
that-
Webster, which is unfortunate, because they're all gonna come either north or east or south, because
Yeah.
there's nothing there. And so they're gonna come here, and when they can find it here, it's cheaper than it would be over there.
Yeah, probably.
So,
Mm.
With gas cheaper, people will drive a little.
oh, you bet they will.
Oh, that's
You bet they will.
true. Commute, right.
Mm-hmm.
Mhm.
Well, we thank you.
Thank you very much. Appreciate it.
Report.
Appreciate your time.
Good things.
I'll see you tomorrow,
You come in.
to Emmitsburg, yeah.
I'll tell you where exactly.
Okay.
College.
Otherwise, I'll just be driving around Emmitsburg looking for it.
Dean, I think you can come on up at the time.
They ask me all the time.
Go, Peggy.
Thank you.
Thank you.
And here's my, summary on the budget. And I realize the VA doesn't have the biggest budget in the county at $73,000, but I always look at it, and I've said it here before, it's an important budget because it shows exactly where the money is being spent for our veterans, on a monthly basis. Our actual, first quarter, let's see here. For the second quarter budget was $18,423. Our expenditures for the second quarter, which is October through December, was $16,536. So we're below our budget expectations. The first two quarters of the year, we're averaging monthly, the average expenditures are $5,500, so we're below our budget, and if we're projected, at the projections, I'm looking at probably around a $7,500 reduction in our, expenditures against our budget by the end of June. There's 4 areas that I really track because it deals pretty much directly with the veterans themselves, and that's the rental, that we help them with, the food vouchers, utilities in Mid-America. The rentals have been running pretty much, at the high point. Our budget was $5,000 a month, or at a quarter, and we're averaging around $5,100 over that quarter. Food vouchers, we budgeted for $850, so we're at $674. Utilities, we budgeted for $1,000, where actual expenditures over that quarter is only $411, so that's down considerably. Mid-America bills, we budgeted for $1,050, and we're at $931. The claims that we have at the VA right now, it's pretty consistent. We have a percent, for pensions, people coming in, applying for pensions, those that are applying for, just for the regular, trying to get into the health care system itself, and the other one is for, service-connected compensation. Those are always the 3 big ones that are pretty consistent. The healthcare system, it takes, once a veteran applies for his health care, it takes about 3 weeks to 4 weeks for the VA to say, yes, you're in the health care, or no, you're not. A pension, a widow's pension, or a veteran's pension can take 3 to 4 months before they get an approval or a denial on that. In the county of Humboldt right now, there's roughly around 950 veterans. So we do a very good job, I think, and I think Humboldt County can be really proud of the fact that, we support our veterans very strongly. From this budget itself, to me it says a lot about Humboldt County, and then if you look at the amount of money that is given to the honor flight over the course of time here, the people in Humboldt County have been very generous. With the honor flights, we have two more flights going this year, May 7th, and then I think September 17th. And they've opened them up, I think you all know this, for the Vietnam veterans now. And the flight in May will still have World War II veterans on it. I think there's 7 World War II veterans signed up for that. A few Korean, and then the rest will be Vietnam vets. And we're getting a pretty good turnout right now for Vietnam vets who want to go on that flight. But the generosity from Humboldt County right now for the honor flight is just as strong as it ever has. So that says a lot about Humboldt County to me.
Some counties, visit with, they have special fund drives, because they can't raise it on money.
Yeah.
Humboldt's always been in great shape.
Yep, and I attribute a lot of that to some of the guys that really push it. Dale Long,
Raymaker did too, didn't he?
yeah,
He was good.
yeah, and Bob Fort, those two are very strong. Craig Mulroy. The Home Base Iowa, Home Base Iowa was designed and put together last year for for veterans, trying to entice veterans to come back to the county to work as they're coming out of the service. And, there's been very little activity at this point yet for Humboldt County of veterans, especially with trying to find the right collar jobs in Humboldt County. There's few and far between. There's some, but not that many. But there is a job fair coming up, I think in March, for home base Iowa. It's all on computer. I'm not sure how well it's gonna work, but there's gonna be 40 employees that, are going to be, offering jobs through that website. Tidbit information, VA hospitals in the country. There's 144 VA hospitals in the United States. 1,200, and there's 1,200 of the VA clinics, such as the one we have down in Fort Dodge. And with that being said, the number of vets that I talk to, which, you know, I normally ask them what kind of service they're getting from the VA hospital in Des Moines or in Iowa City. Most of them are very happy with the service that the VA is given to them. So you hear a lot of negative things about the VA through the country, but I think in Iowa here, I think that this state really does a good job on supporting our veterans, and I think it's a good indicator, just asking those veterans that I see all the time, what kind of service they're getting, and they're all very happy about it. Now, that being said, that's all I've got. Anybody have any questions?
Are you getting more young people coming back? You know, the old college guard's gonna run out someday. Can you get some of the younger guys to participate?
Well, they've got a couple that are interested right now to the VFW. And I don't know how, I'm not sure, they're not even 25-year-olds, they're more like the 55, 60-year-olds. It's hard to get the young Afghanistan veterans, the Iraqi veterans, really interested in joining the VFW or the Legion.
What, I don't know if you know the number, but you said 950 vets, what's the average age?
Average age is over 60.
That's what I wondered.
Yeah. And they say over the next 30 years, the number of veterans in the United States, today there's over 22 million veterans in the U.S., and I think in 25 years, that number will drop down to around 17 million. But, that's all contingent on what goes on in the world.
Sure.
Okay, thanks, Dean.
Thank you.
We got to give them that one back, that one.
Before we leave, Dean, we need a motion to accept and place on file his quarterly report for the Veterans Affairs.
I move. Dean, as far as your budget goes, the same dollars next year is what you're requesting?
Will it be the same?
Yeah.
Actually, about $3,500 less.
That's what you,
Yeah.
okay.
Good question. All those in favor?
Aye.
Opposed, carried. Thanks, Dean.
Yeah, thanks.
Oh, on this one too? Yep. Michelle, you can come on up when you're ready.
I bet Michelle's gonna give us money.
You've been around me too long.
I know.
I thought it was good for Michelle up here, because she didn't know you were on the board now, so it's the first time you got
Not
that.
fair.
I'm sorry.
That's not fair.
That's not fair.
Okay. Well, then I won't say what I looked at.
And I assume you guys can...
I know, you didn't know who I was.
And then you walked in and, oh, I forgot to see.
She changed her name.
Yeah, okay, so we're both good.
We're good.
We know each other.
Well, Michelle and I had our
Board of Health meeting, or our group did last week, and I said it'd be great if she'd wanna run up, and I said, till 12 o'clock noon on Thursday, you can still get in. I see she got her done, so. I'm glad she could come up, 'cause, you know, I think Michelle's office and things have been changing here in the last couple of years, and she'll probably give you a little rundown about that, so.
If you guys wanna look, I just quickly printed off some handouts. This is what we do every month to kind of tally our visits and everything. So I gave you a comparison of what we had in 2015 and to where we currently are in 2016. And there's 4 sheets there of different visits, so you'll see them kind of broken up. The first couple sets is just our overall public health visits. So it's our homemaker personal care nurses, what we do for HOPES, health promotion and med management, and then the second 2 sets are 2 sheets that are set together, break down WIC, immunizations, flu, blood pressures, corporate health, and our school audits. And so just so you guys don't have to do as much math in your head, on the first 2 pages where we have just our overall public health visits, so far compared to last year to this year so far, in the fiscal year, our homemaker visits, which is our top one, and that's where we go into people's homes and help them with basic homemaker skills, cleaning, laundry, meal preparation, grocery shopping, things that they just can't necessarily do on their own anymore. And in November and December, our visits decreased just a little bit, but every other month was up. And then in personal care, the only month that has decreased has been December. And personal care is when we go in and help people with actual baths, or maybe putting on pet hose, anything where our hands are actually touching the patient. And then we have our nurse visits that are again kind of up and down. Same with Early Head Start. And Early Head Start and HOPES, that's our program that works with prenatal through 3 years old. And so we have 2 family support workers and an interpreter that works with that program and does the visits in the family homes, working with our young moms and dads. And those visits, again, kind of up and down. Our HOPES visits have actually been up this year. The numbers have been up so far. And then postpartum just really kind of depends on how many babies are born in our county per year and how many we're notified of. And then we can go out and do a postpartum visit with the mom and dad to help them. And our health promotion, I kind of want to explain that a little bit. We've always done health promotion visits where it might just be where the physician calls and says, hey, can you go check on this person, make sure they're doing okay in their home. But we've started a new program within this fiscal year where every patient that is discharged from Humboldt County Memorial Hospital on the inpatient floor, and if they are going home, not going to another facility or a nursing home or anything like that, but if they're going home, then our nurses contact them and either visit with them over the phone or try to go out and make an actual home visit to make sure that they understand their discharge instructions, they have their medications set up, they have all their follow-up appointments ready to go, just to try to help them so they don't ever have to, not ever, but for the same purpose, be readmitted to the hospital so that we can keep them in their homes instead of back in the hospital. So that's kind of a new thing we've started doing.
That start January 1st, or before?
Started before that. It started probably August. We kind of started dabbling in it a little bit. And what we've seen so far...
They're coming up a little bit.
Yeah, they're coming up just a little bit. Probably about half the people who are discharged would prefer no visit, phone calls fine. The other half, we'll go out, we'll do an actual visit with them. If they need a referral to a Medicare certified home health agency, we will do that. Otherwise, if we can admit them to our services, if they need help with that, we'll do that also. So it's just kind of starting to get off the ground and running, and so the girls are kind of excited about that. It's just, you know, something to kind of help overall. And looking at this sheet overall, so far this fiscal year, we've increased visits 116 compared to last fiscal year, the first half of last fiscal year. So our numbers are improving, whether it's, you know, 1 month the homemaker visits are really high and the next month it's nursing visits, just kind of depends. But overall, the public health visits have increased by 116 visits so far this fiscal year. And then your next two sheets breaks down more of, like I said, our WIC, our immunizations, and again, WIC numbers, they look kind of funny on here. You'll see like maybe 2 months are really high and the third month dips down. But our WIC parents only come into the clinic once every 3 months. So, you know, every third month we might have a lower number because they're only coming in on that, 3-month rotation. And one thing that I want to point out on here, you'll see like flu vaccine is, this year we did a little bit over 100 more shots than we did last year. And I contribute that to, we were able to partner with the school district this year and go into the schools and provide flu shots during parent-teacher conferences. So we had a nurse at Meath, Taft, St. Mary's, and the junior high. And so parents could go for their school conferences with their children and then get their flu shots, either theirs or their children's or whoever needed it. So that was kind of an exciting thing for us to do, and I believe we're gonna get to go back next year and do that as well. And so, very positive feedback from the community on that. The parents liked that quite a bit, instead of trying to have to get their kids out to a public clinic.
Don't you go into some of the manufacturers?
We go into the businesses, yes. We go into roughly like 34 businesses here in town too, during the flu season, usually September, October. We go into the businesses, we now go into the schools, and we also go to all the surrounding towns, plus we do 2 clinics in Humboldt. So, and we, after 1st of November, we just set up times where people can come out to our office. And so that's why you see, like in January, we still had 17 shots we gave, and in December, 27. Those are people coming out to public health and getting their flu vaccines out there now. So we still have some people coming in, and that's good. And the other thing I wanted to point out, our immunization numbers are low, and we've talked a lot about that. Nancy Brandhoy is our immunization nurse, and so her and I have kind of talked about what we need to do to kind of try to improve those numbers. But when we look at the overall system, a lot of adults and children are still getting their immunizations. They might not be coming to public health to do that. They might be going to their regular primary care physician and getting that done. But we're still kind of looking into how do we promote that better to ensure that everybody's getting the vaccinations that they need. And with that being said, I am presently in the process of interviewing for a full-time nurse out at Public Health. And that's like way exciting for us because we haven't had a full-time public health nurse for quite a while. So we're really excited. That person is going to be able to come in and kind of assist in a lot of programs, and then take some programs kind of as her specialty area. But some of the things that Nancy does right now is going to go to the senior nurse, and so then Nancy's going to have time to focus on the immunizations. Right now, everybody's kind of spread pretty thin and dabble in a lot of different programs, and so this will kind of help assist where people can put more focus in one area that's needed. So we're kind of excited about that at this present time, too. And then the last page you guys have is just kind of a quick rundown of different programs that we do out at Public Health. And while I was looking at this morning, I thought, boy, there's a couple things I don't have on here. The health promotion visits that we just talked about isn't on this list. And then also, Julie Whiter and Meg Thompson have recently been trained in the Freedom from Smoking class. And so they are going to offer some smoking cessation classes to the community. The first one's going to kick off in March. And then that's something we're hoping to be able to roll over into the businesses too, and help within their facilities to assist them in becoming smoke-free and tobacco-free as they want or as needed. So that's kind of a newer program that we're kicking off there as well. And with our corporate health and wellness clinics, we are working with the hospital right now to start up again like a pre-employment screening program for our local businesses here in Humboldt County to kind of, we've had some stuff in the past, but we just kind of want to build that program up and be able to offer more services to the local businesses here and see if we can't help with a little bit of that. I don't know.
I know one thing that's nice is having the interpreter
Yes.
to work, and she's part of her program in doing some of them, she's not just interpreting. That's been a big plus, I think, 'cause
Yeah.
I mean, that's important in our community to have, and this opening that she's talking about, we had another person that was doing part-time work with us, and now she'll have a full-time nurse now, so this is a good thing too, 'cause as changes come and changeovers, it's nice to get some new, younger, I mean, I'm sure you'll be able to produce some interest in this position.
Yes, yes. And we do have, as you see toward the bottom, it says China HIP. That's our community, needs assessment, health improvement process. And so every few years, we do a China HIP, and that is where we collect data within the county through surveys and different things. So we've been doing that over the past year, and now I'm in the process of compiling all that information, and that is due in February, so right next month. And what that does, it breaks it down into what are some of our biggest areas of need in Humboldt County. The last time we did this, both adult and child obesity were on there. Lack of Title 19 dentists in Humboldt County. And now I'm drawing a blank as to what some of the other ones were. But those, I foresee those still being needs within our community. And also there's a lot more focus on wellness. And so I see that as being one of the needs that we're gonna have. And so part of this new nurse's position will be to kind of work with the schools and with the businesses, along with Julie Weigert, who does some of our wellness stuff, as to what the needs of our China HIP are and how we need to address those in Humboldt County, along with community partners at the same time.
So she'll be busy.
She will be busy, just doesn't know it yet.
I got any questions for Michelle?
Questions for me?
I saw yesterday, and there was a county, I can't remember which one it was, but it was fairly close to us, they had confirmed case of mumps. Close to us.
We have not gotten an alert. Typically how, like if a county, has an outbreak or a communicable disease, Iowa Department of Public Health lets us know that. And usually even if there's one surrounding us, they let us know, but I have not received an email yet, but
Well,
what does it mean?
someone said it was on Facebook, and...
Oh, well, then it's true.
I don't know if it was Rockwell, I wanna say it was over towards Rockwell City.
Okay, okay.
I don't know how close they...
I'll have to look into
I
that.
heard something about that too, but I don't remember where.
Okay.
Now that you say Rockwell City, that does sound like...
somewhere over that direction, I just...
It has been contained kind of in Johnson County and all of that.
Right.
But with the holidays and stuff, we kind of anticipated that we would see more.
So would we be prepared if, I mean, we have...
Yes, we're working right now, we have county preparedness, and public health is the lead within our county, partnering with the hospital. And now that we have Melody Larson, we are working with, trying to set up some stuff with her so we can just have like a full county plan instead of everybody having individual plans. But the hospital is prepared to, basically deal with anything that comes out that way, kind of like we were when Ebola was rearing its ugly head. We have a process in place as to public health is always the first call, and then we partner with the hospital in notifying them, and then we get kind of like all of our protective equipment out. We have a triage room out of the ER that person would immediately go to, and then we notify Iowa Department of Public Health, and they basically direct us as to how we need to proceed.
So, some of those things that we've kind of had at bay for a long time, that
Starting to pop back
scares
up.
you.
Mhm. Yeah. I think we're better prepared for it now than we ever were. But that's not to say that something can't pop up.
Sure. Well,
Have you noticed an increase or decrease in the number of flu? It seems like every pharmacy now has got their shingle hanging out there. I didn't realize it till this year, a pharmacist is legally can give injections.
Yes, they can.
Are they taking some of your clients?
They are, but I think for us, what's been kind of our saving grace is that we have the relationships built up with the businesses already. We go to them, whether Meg and Julie are there at 6 o'clock in the morning, you know, or we go late in the evenings. We've done weekends in the past. And so I think that has helped, that we can partner with some of that. And this year we were not supposed to have a delay in flu mist, but we did. And so what we can do is we have a strong enough partnership, like, we can call up Hy-Vee and say, do you have any? If we don't have any at Public Health or the hospital, and we just direct people out there. Or if they don't, they direct them to us, and so it's kind of a give or take.
The important thing is that they get them, no matter where they go.
Yes.
Because when they're in the mood to do it, that's the time to get it right,
Yes,
so.
yes, we
Some
don't
board members have
wait,
no problem.
we have some board members who are not very timely.
We like to play it out, don't we?
I guess I go on that list.
Well, we would be more than happy at Public Health to get you your flu shot.
You know what, I'd rather take a beating than get a shot. I had to have my blood drawn this morning, I don't think I slept last night, and the lady's like, she puts the thing on me, and it's like, well, there's the vein, she hits it the first time, I'm just like, why can't you do that all the time? Because everywhere else, I go there, it's, oh, your veins are so deep. As they poked me 14 times trying to find them.
We'll just give you a tiny little shot in your arm, that's all it is.
I know,
Just
but
a
I
little pinch.
hate
That's
needles,
it.
See how bad it is?
I know, look at all these big strapping men around here who are scaring our little needles. But-
Well, the other thing is maybe, like at the elevators in the fall, you got all them people coming in and out, do they do them? I've never seen them do them.
We have not done
You have a
that.
lot of farmers that are stubborn type people that maybe you should set in.
They don't have time for a flu shot.
Oh, I know, they're all busy.
I know, but while they're there, we sure can take care of
Time for
that.
that cup of coffee, but not a flu.
There you go. Set right by the coffee pot and they'd have to do it.
Coffee in the shop?
Yeah.
That usually would work.
Taking notes on that.
I am.
Well, you know,
We're always open to new opportunities though, because, I mean, if we
Second
can
one was more of an accident.
help save some of this, then that's what we wanna do.
I know that you've done it in some churches
Mm-hmm,
and our elderly people at our church appreciate that.
yes, yes.
Because they're always, you know, as it gets colder, they come out less and less, so.
Mhm. And we try to think outside of the box on how to best promote this and how to, get the most people vaccinated that we can. And so the girls have done a pretty good job of trying to come up with ideas, but that's a great idea.
And knock on wood, we haven't had any lockdowns at Springville, and
No,
so we're
no.
ahead of it
We've had
that way.
some stomach flu issues, but again, your flu shot's not gonna cover that.
Right.
And so,
Doctors in Florida did state that, the few the cases that have been in the state of Iowa have been a lot milder, so they thought they had the right mixture this year, you know, I think sometimes when it doesn't hit on the right combination, people go, oh, why did they do this?
Right.
Yeah.
But apparently this year, we maybe are getting a better broad coverage of the ones that they thought were, maybe we're getting better as we do it more and more, I don't know.
He's checking his recorder.
on your way, Ken?
No,
You know?
Just wondering if it's going up.
Budget-wise, as far as that goes, we are not asking for an increase this year, we're staying the same. We redid our contract, Peggy, was that a year ago, 2 years ago?
What do we decide on that? Is it
90.
Is it 90?
90,000, we went from 75 to 90.
Good, very good. Well, I'm glad you could come up, I think it's always good to...
Well, we got you, the Captain Williams, can you tell us about the new building program out there, what's going on?
That would be more of a question for Victor Bycroft or
Okay,
Michelle
okay.
Slater. I can tell you that, eventually the plan is Public Health will be, and the clinic will all be one with the hospital, which will be awesome for us as Public Health. We've never been attached to the hospital. And so working with the other departments, it's great because our partnerships are wonderful with all the other departments out there. But there's still that barrier, you know, oh, you gotta walk across parking lot, it's freezing rain or whatever. And so it'll be really nice to be in the same facility with
And I
them.
think long-term with the recruiting going on for younger new doctors, this is probably gonna be a tougher time
Yeah.
to, because that's what will help, maintain new people here, I think, too.
Yeah.
So it's
We're
kinda
excited
exciting.
about it.
That's good.
Thanks, Michelle.
Thank you.
Have a good week.
Paul just walked by, but I think he might have went into it, Peggy's.
Let's go ahead and,
There he goes.
here he comes. Oh, he is on time. He stepped right up. We gotta run a tight ship here.
He dressed up for us.
See the work on his face?
Looking nice.
Good morning.
Morning.
We have, one agenda item, it's to, approve plans and specs and set letting date for three bridge to box culvert projects in the county. The first one is project LC 282950, located on 200th between Nevada and Ohio. That's up here in Grove Township off the east of K Road. The second project, there is a correction here for you, Peggy. It's project number LC 391616.
1660, okay.
That's the original bridge, LC 391660, located on 120th between Iowa and Juniper. That is the bridge that burnt up this fall, and that is
60 as opposed to 50.
Yeah, so that's the original bridge number.
Okay.
16.
I thought you said 16 too,
You said
but it says
16,
bridge.
391660.
That's a little quick.
Yeah.
All right,
I was looking for-
9329, section 16, 6/10 east of the northwest corner. And it's closer to 5/10, that's why Ben added it 5.
Which township is that one, Paul?
That would be in Delana Township.
Okay.
The last one is LC, 192810. On 260th between Iowa and Juniper, and that is, down in Corinth Township.
Are these all gonna be taken as separate bids, or can you group these all together?
No, these are all separate. They're individual. We have the late start dates, shifted around. The first one, let's see, the order of this is, we start with, the big one, the 14x14, the one up in Delana Township, with a late start of 8:15, with 20 working days. Then the next one is, the one up in Grove Township with a 9/12/16, late start date. And the last one is, I just told you wrong.
12x12.
The first one was the 14x14, the 8x815, 216, and that is the 391660. The second one is the 12x12, which is out in Corinth, which is 192810, and that's 912. And the last one is the smallest one, that's the Grove structure, the 282950, and that's 926. Feasibly, one contractor could come in and sweep them all and not have a problem, even if they started at the late start date of the first one.
So it's possible.
That would be our hope.
The 14x14 is definitely a crane project. The people that own cranes are more competitive than those that have to rent them. So, the last one that we did was 14x14, went to a person that rented the crane. So you tell me.
Well, I guess you would hope that they got to bid on 3 projects that...
Oh, they'll get to bid on all of them.
No, I'm saying, but it'll be more competitive.
Yeah, 'cause then they can have one mow. On the other hand, we
Right.
did not tie them and force them to take all 3.
Right.
Because we have, a lot of contractors, more contractors that would be looking at a 10x10 than the 14x14.
So you set the bid date for all of them, if we wanna bid on it, take individual projects, and those are there to bid on this project, talk about this.
They can bid on
One or all.
one or all.
Makes sense.
When we have similar projects, similar sign, we've tied them. We did that with, these projects that we finished 2 years ago. There was 4 of them. They were all 10x10s and 8x8s. And Rugness Brothers took all 4 of them. They were all tied. They were all on gravel roads, yeah. But these are, this should be the last of our boxes. We have a, BR project, that's a bridge to box up in, Humboldt Township, just east of the Divine Bridge. With these 3, plus the 2-to-1 already let, will give us 5 bridges to boxes next summer. And, so that will keep the boys hopping.
What do you got in mind for a date?
Date, I propose, February 18th at 10 a.m. in the morning.
Is that here or your office?
That'd be here.
Okay.
Was that the one you sent us the other day?
Yes, it
Got it
is.
written down already. Good point.
It's nice to have three here. It's nice to have a quorum. Again, we would receive all the bids, that is, it should be a Thursday, if my mind suits me well.
Yeah.
The DOT letting is, that week on Tuesday, and this would be following right after the letting then.
You said that's here rather than your office?
No, that's here. All the lettings that
Okay.
we generally have are right here.
Okay.
Peggy's involved with these, and everybody knows to come here for that.
At what time of the day?
10 o'clock.
Any other questions for Paul on this? Would we have a motion to approve the plans and specs and set this date, February 18th at 10 o'clock for the replacement of box culverts?
So moved. I'll second.
Bruce? Rick? Any other discussion for Paul? Seeing none, all those in favor?
Aye.
Carried.
Otherwise, that's what we have for this week, 3 PM, work session at secondary roads.
Yep.
Drawing table will be going at icing by then?
Oh, that'd be good.
Just try to get reported.
I need, if I could guarantee that, I would be sitting in this chair.
Yeah.
Otherwise, no news is good news. I don't think anything else at this point.
Any word on that new truck yet?
The new truck is there, the snow equipment is not.
Oh.
The snow equipment was due here this week, last week in January. And he said roughly about...
Hopefully not coming from the east coast, so it gets stolen.
It's Manchester.
It gets stolen.
East coast of Iowa.
East coast of...
Otherwise, we've hauled rock, we have stockpiles complete in Hardy and Thor. We got a start east of Livermore, but we are not, or actually, we're running, the northern routes are running this morning, just cleaning up. There's just little skiffs here and there.
Thanks, Paul.
Thanks, sir.
Thank you.
Committee reports.
I think Tuesday was the only meeting I had, and that was the landfill down in Fort Dodge. We had our executive board meeting at 5, and then the full board at 7. And, they talked about their household waste management building has been let, and they've started pouring footings and tough stuff for that. It's supposed to be up by June of next year. And they're gonna run it a while, just for the Fort Dodge area. And then they're gonna try to get mobile units out to the smaller communities.
Oh, that'd be nice.
Yeah, that's the plan.
About that mobile unit would be probably
Yeah.
a big key to that.
And that's about it on there.
Hey, Rick, the law enforcement center.
Oh,
Did I see this morning they got the main door open?
Possibly. Yeah, I should give you an update on the LEC. We were supposed to have a punch list on Friday. I was in there Thursday, and there was no way they're gonna be ready by Friday. So we moved it back to Wednesday. He assured me that after you do the punch list on Wednesday, they have 5 days, the subs, to complete the project. It's something in the contract. Once you give them the punch list, they got 5 days to get it completed. So they wanted to get to that point, get them subs in there, get the stuff done. And, it is coming together, and I think the consoles were put in last week. Those are pretty amazing.
Yeah, I stopped, they were just moving equipment.
Yeah, and then the furniture's coming in this week, I think Wednesday or Thursday. So by the end of this week, it'll be 99.9% complete, hopefully.
I mean, there was just guys working everywhere.
Oh, they were scurrying.
They really couldn't walk around, they
I
were
know.
tripping on a guy. and-
But when I was in there Thursday, there was some tile that had to be laid yet, they're welding on a door frame, I could see they weren't gonna be done by
They were
Friday.
welding to that, man, they just got a lot of...
So I said, let's push it back to Wednesday, so our punch list is way smaller.
Yeah, there's no need to have a big punch list.
No.
Cumbersome to figure out.
Yeah. So, we're gonna have a meeting Wednesday morning and go through that.
I think the departments are ready to get...
They're ready to
They're
get
getting
moved, yeah.
They're getting close to wanting to do that.
But that dispatch center's gonna be really nice.
It looks like...
Well, the whole facility will be really nice, 'cause it's gonna have a nice room in it, and everybody's gonna be able to, have good working conditions. That's about all I had.
Wednesday, I went to Des Moines for the ISAC Wednesday afternoon and Thursday. Got the several different speakers that listened to. Probably the one that was the most entertaining was the one towards, at the end, with the gentleman originally from Lamar's, that was a graduate from Iowa, and ended up working for the CIA for 30-some years, so it was very, and I think his whole gist was, patriotism's alive and well in the United States, and I think he really had us all leaning forward, kinda like, watching a movie. I mean, he was just very, very interesting person to listen to, and I'm thankful that we have people like that basically, in his eyes, or he looked a lie to his family because of the fact he couldn't tell anybody anything, so it was one of the best things I've listened to in a long time. So, and then this week I'm here, there, and everywhere, so hopefully get to all of them, so that's all I had.
Very good. Tuesday morning, I guess, I went to Des Moines to Iowa County Technology Services, ICTS. It's advisory committee for ISAC board on electronic transmissions. This committee really has three main parts: the compliance, the operation, and the finance. They have specialists that work in those fields all the time. They report to us, and then we just basically listen to their reports and then pass that along to the ISAC board. Peggy, you get involved with hearing those reports sometimes. And one of the pieces of paper they handed us here, I didn't realize this, all the users, they had, in the month of August, we got one report, they had 17,959 transmissions by electronics, to and from, back and forth. So there's a lot of activity there that report, they use it for billing, they use it for complaints, they use it for users. And I didn't realize it was a big operation, but there's over, our budget alone is $350,000. I think the big board has got, what, close to $1 million, I think, in usage of this transmission for all the mental health things. Okay, that was Tuesday. Tuesday night, we had an executive meeting of the supervisors, planning for, the next meetings we got coming up in February, trying to get the plans put together for meetings there. One of the things we got, or tentatively got planned, is have the CEO from each of the three mental and managed care health organizations come and talk to us. You hear so much about the Medicare and what's gonna happen here and what's gonna happen there, but you know what? We've been trying for 2 weeks to get them to answer the phone. We send them emails, so far they haven't answered us.
Really?
We're gonna give up. The backup for that is to get somebody from economic development that's been there before, but we're still trying to get at least representatives from these three managed care organizations to talk to us. And their task is, we've asked them to tell us, either in a panel or a presentation, what we as counties can do to cooperate with them. I don't know whether they're working with that or not. Couple other things we got planned there, they'll have the legislative reports, naturally, roundtable, we're gonna get into mental health there, we'll get into, law enforcement, to see what other counties have gotten, like we've entered into that same discussion. Then at noon, we'll have a luncheon with the legislators. We're gonna be meeting at Embassy Suites on the 11th of February, that's where the meetings are held this year. We got two legislators that they're gonna give an award to. The head of the Transportation Committee, both the House and the Senate, that helped us get this gas tax passed last year. So we're gonna pat them on the back a little bit and give them a little plaque. So that's some of the things planned for that particular meeting. And then the next thing, that committee came up with a subcommittee meeting too, and I passed around a piece of paper here this morning. You saw in the paper where Branstad's come up with the idea of taking some of that 1 cent levy that's been allocated to the school up to the year 2029. They're wanting to expand that now to 2049, and peel some of that off and use it for water quality. and there's kind of a riff-raff going, some people support it, some don't. So, after the ISAC meeting on the 11th of February, we're gonna meet with some legislators. That committee's been formed, and they're asking us to go back to every board and ask if you have any concerns, anything you'd like to have brought forth for the use of those funds, whether you think it's a good idea, a bad idea, how the money should be spent, those kind of things. We come up with those, we gotta get back to Bill Heffroth, he's going to tabulate those, so we'll have something to talk on when we get there. So that was the extent of that one. Let's see, what else we have going. I had to write these down, because I just ran in circles this weekend. Well, the third one we planned on, ISAC University, which, Peggy was there and Bruce was there, they had some very good speakers. The CIA I gave was good. We had a fellow, a 17-year-old from eastern Iowa, or western Illinois, one of the two, I don't know. Anyway, he started out cleaning up rivers when he was 17 years of age. And he developed into a corporation, and now he's got a $2 million budget, 90 employees. They've gone up and down the rivers and cleaned up a lot of trash. He started with a single rowboat, now he's got barges. They got contracts with communities to clean up. I think we had a spin-off of that, come through Humboldt into Dakota City once. So that's one of the speakers we had. He was named CNN Man of the Year or something, is because of all the things he got going for this nonprofit. And the other thing at that meeting I thought was really interesting, a very keynote speaker we had a guy who's taught us how to remember names.
Oh, my goodness.
I was dumb enough to buy his book. In the preface of the book, he said, he's giving credit to his parents. He said, his dad could still remember his locker number from high school, and his mother could give all the states of the United States in order in 60 seconds. He says, I hope I can still do it, I'm 90 years old too. But he took us through a whole bunch of things, Peggy, you remember that?
Made you feel really good.
Well, what was this guy's name?
Paul Moore.
I couldn't remember. Well, he had this lady take, and she had a list of 25 numbers. Random, and then she put, was it an item? It wasn't-
25 items,
Yeah.
random items, 10, top 10, anyway.
And then he'd start talking, and then he'd say, and what's number 3? And she'd say, so it's a book, it's a book, it's a book, and then he'd go back to speaking, and then he gets to 25, and so then, the question is gonna be okay,
How many?
now, how many can you guys remember? So, I feel like really dumb, I'm sitting there, and it's like I got the first 3 and maybe the last 2, and these people are over there going down there, Carl and them, all them guys, and I'm like, wow. And then he just starts wheeling them off, and it's like, then he explained how he did it, and I still don't think I'm any better at this.
And he did it backwards at every other one.
Yeah.
Unbelievable. And there's a technique to that. I haven't read the book yet, but there's some way you associate each item with something. And for example, when you meet somebody, we're usually interested in worrying about what we're gonna say. You say, Bruce, we forget his name, and we think something about him. You gotta associate his name with some word, and say his name first. And say, Bruce, I'm glad to meet you, not, I'm glad to meet you, Bruce. All kinds of little tricks that you...
Yeah, and that was probably the best part, was trying to recall the name, and, 'cause I'm terrible at that. He was very interesting too. Other than it made you really feel uncomfortable. When
He sure did.
When he looked at you, you were like, well, I'm not gonna make my mind what,
Bruce said right in front of you, don't get picked on. Couple other good speakers, we had the cross-country track coach from West High in Iowa City. Talk about the good things. He talked about all the positive things he used in coaching girls track, and he went on for an hour, but it's things we need to do in public to make people feel good and bring the best out of them. He did that with these high school kids. There's a couple other good meetings. One of them was not so good, I didn't think. The parliamentary procedure, what I about went to sleep in. I think we do a pretty good job in here. But Peggy, you probably got some more things you picked up out of that.
No, I just keep thinking back to the CIA guy and the sacrifice that he made, for his family and for his country, and, to be able to live that life and,
Remember
For
him?
30 years.
Yeah.
Not just 3 months.
Yeah.
I can show you a picture of him, I got my picture taken with him. He looks, and you know what, his,
And I've got a book on one.
When you see the guy,
Yeah,
he looks like this little,
Yeah.
he's just this little,
Yeah, he's,
You
you wish everybody next to you looks kinda...
well,
Yeah.
but he
wouldn't
would
look like a CIA director.
But, you know, when he started telling us about this, and it's like, oh, come on.
Somebody asked him how he got recruited. Well, he was in the Navy 4 years from Lamar's, Iowa. Decided he wanted to go to law school, he went to Iowa. He got a call one day from somebody wanting to meet him at Des Moines
Des Moines
Hotel.
Hotel, Savory Hotel.
Gonna offer him a job in something in the government. I said, what is it? Well, I'll just tell you about something different. Well, they had CIA guys meeting, and he had to swear not to tell them what it's about.
Even that meeting, in case he didn't join, yeah.
Then he went on to tell that every college campus and a lot of big corporations have members of the CIA on staff in there all the time, recruiting people to become part of their membership or watching everybody. So we may have somebody in this room, we don't know.
Sure.
But he has a book out, and my daughter's trying to find a
Oh, yeah.
copy of it on,
Pretty good.
and if we get it all, we'll share it.
But that ISAC University only meets every other year. They alternate that with new school officers. So if you get a chance to go to ISAC University, last time we had a guy from Nebraska that had his arm severed as a fourth grader or something, he went ahead and played basketball at a small college. Anyway, those are really motivating. We had 6 of those things over the 2 days. And there's 176 people there, and they represented supervisors, sheriffs, engineers, the whole gamut was there. And they had it a little short because the weather was bad in southern Iowa, and they didn't get up there, but it's really interesting, so. If you get a chance to go to those things, that's one of the better ones,
Thanks, Carl.
in the report.
Peggy, I had our emergency management meeting on the 18th at 3:30 in the afternoon. And we had 12 out of our 15 members there, so we had more than enough for a quorum. We went through that, we went through the budget, like the chairman and vice chair, and approved the budget sent forward to us. So I told, Melanie maybe she could come up and just highlight a few things about that when we go through her budget, so she could meet Bruce and some other, and just kinda go over her program. She came across very good. She went over Iowa Code 29C, gave everybody a booklet, just kinda study how the layout of the whole program, Emergency Financial Works, which I thought was good. And I know she's working with Michelle on some stuff. She talked about courthouse security a little bit. Maybe she talked, did she talk to you yet about that? I mean, they're working.
It's in our meeting.
Okay, maybe that's what she mentioned. And then she also mentioned that in June, July, they're gonna do a joint activity with Wright County, and this will be a regional test, and it's gonna be an emergency on livestock. And I thought that was, really, for her to get her feet wet and have one of, go through one of those, projects first with Wright County, so she sees how they set it up, and then eventually I'm sure we'll have some in here. So she seems very active, been very busy, and I don't know, it's nice to see all the mayors there. Made the committee go good.
She did something right, if you got that many people there.
Yeah, she's been out talking to them. And then I guess they had the Board of Health meeting on the 21st, at 7 a.m. in the morning. I won't go over any of that, because Michelle kinda went over some of the highlights of it, and things are going well there, I guess. I'm excited about our new nurse too. That's all I have.
Okay.
Anybody else? Anybody have anything else, Peggy?
Had an ISAC board meeting on Friday, just gearing up for their budget also, getting their plans together, so they'll be putting that together in February, March. They have their schedule together since they're switching to the new, in 17, they'll start their fall school in August instead of November. So then ISAC will have to have their legislative priorities earlier, so they were able to give us kind of a schedule, and I'm gonna get that out to our district vice president, and maybe I'll give it, or I bet Berlin will give it to you, Carl, so that the supervisors can see too what that legislative, schedule is, so that you can get your priorities and your everything put together before, and meet their timelines. So, other than that, we welcomed some new members to the ISAC board this year. Joan McCalmont, reporter, was, sworn in as president this year, and first vice. Lonnie Perkalbeck, the sheriff from Johnson County, is third vice, and then Eric Stearman, Dubuque, over in Dubuque, what, here's 4th.
Did you hear what Melvin Hauser's doing?
Uh-uh.
He's taking out papers to be an auditor in Potawatomi County.
You're
He
kidding
said he wanted to
me?
bring her pastures, get out of the supervisor.
Oh, for Pete's sake, I didn't, is he really, or is he just kidding you?
No, he's serious.
He really is
Yeah,
doing it?
yeah, retiring.
All right. So the gal over there must be retiring too then, okay.
Oh, Melvin, he ain't no spring
Yeah.
chicken.
No, I can't see why he won't.
Yeah.
He's got 30 miles to drive to work every day too, he lives up on the way
Oh, my
from
goodness.
Nelson Bluffs.
Yeah.
Wow. Okay, thanks, Peggy.
Mhm.
There's nothing else, we have motion to adjourn.
I'll move we adjourn.
Second? Mark, second.
Yep, okay.
All those in favor?
Aye.
Right. 9:40 minutes.